Tribe. Today we're going to be talking about herbs that can help support healthy lactation and increase milk supply. So there's an action in herbs that is called a galactagogue. So when you see this listed, if you're researching, that is what a galactagogue is. It's an herb that helps to increase breast milk production in nursing mothers. So I've gathered a few galactagogues together. This is not an extensive list. This is not every galactagogue there is. However, there's some common ones in here that you can use when you're trying to decide. Maybe if you're looking at some of the nursing teas, or you're looking at some of the nursing supplements, or even if you want to make your own tea blend, these are some herbs that you could incorporate into your routine to help boost milk production if you're having an issue with that. So the first one here, and I've listed the common name and the botanical name for you, is Blessed Thistle. I have a dose here. This is for if you're making an infusion. So in Blessed Thistle, there are no known interactions. However, it should not be taken while pregnant. This is a really common one. You'll see this in a lot of nursing blends. It's been used for a long time for boosting milk production. The next one is Fennel, which you can use in a tincture, you can use it in a tea, or you may choose to incorporate fennel liberally into the diet in culinary preparations. I cited one small single study here that was conducted in rats that said it may increase the bioavailability of an antibiotic. So that's just kind of something to keep in mind, and that it should be avoided during pregnancy as it may inhibit fertility. It's also antispasmodic, carminative. It's an expectorant and an estrogen modulator. Then garlic, we listed here. Now this one is not a galactagogue. However, there was an interesting study that showed that babies will suckle longer and ingested more milk from mothers consuming a garlic supplement. These effects occurred after there was a noticeable difference in milk odor, roughly 2 hours after the consumption of the garlic supplement. So this could help to stimulate milk production naturally, since it works on a supply and demand. So if the baby's suckling longer and taking in more milk, it may stimulate your body to produce more milk. And then just a couple notes on that, on taking garlic supplements, would be that if you're taking medicinal doses of garlic, it should be discontinued 7 to 10 days before any scheduled surgeries. And that's because it can have the ability to thin the blood, which also means it may increase the effects of blood thinners. So it should not be taken in doses greater than 5 grams if you're taking a drug called warfarin. The next one is goat's rue. This is another common one that's used. You can take it in a tincture, you can use it as a dried herb infusion. The one caveat with that is that you should not take it if you are on hypoglycemic drugs. The next herb that I have listed here is holy basil. Sometimes you'll see it listed as tulsi. There's also a brand of tea called tulsi, and that's just holy basil. Now, a few cautions with that is that some studies suggest that it may speed up the elimination of certain medications, and it could also inhibit fertility, so it should be avoided by those who are pregnant or trying to become pregnant. A bonus on holy basil is that it can be helpful with situational stress or depression. So that means if you have something going on in your life at the moment that's causing you stress or depression, that it may help alleviate some of those symptoms. So if you were maybe stressed out about it's time for you to go back to work and that's causing you some stress or anxiety, then holy basil may do double duty there for you by helping relieve some of the stress and also boost milk production. And stress is something that could actually lower milk production, so it would be helpful there. It is also possible for it to help strengthen the respiratory system. It's antiviral, antibacterial, anti-inflammatory. It supports normal cortisol levels and blood sugar levels. And that one was holy basil. And then a few little just lifestyle changes would be to make sure that you're drinking plenty of water, because we need that water to produce milk. Rest is very important in breast milk production, and even though I know it's sometimes hard for us to get extra rest when we have little ones sleeping or eating through the night, but lack of sleep can help or can reduce milk supplies, so we want to rest when we can. And then some foods that may help us kind of naturally produce more milk would be apricots, asparagus, green beans, carrots, sweet potatoes, parsley, leafy greens, and grains, whole grains if they're well tolerated. And then one other note I like to tell nursing moms is if you are not on a probiotic, that might be something to look into. It doesn't increase milk supply, but it does increase the quality of the milk, because our bodies can only give what we have. So if our microbiota or our gut flora is not optimal, then we're not passing on as many probiotics to baby as we possibly could. So when you look at a probiotic, then you can basically dose the baby with healthy bacteria without having to give them a supplement. So they're going to get the benefits of you taking a probiotic through your breast milk. It's kind of a crucial time as they're growing and they're young to build their microbiota, and they will get that through breast milk, also skin to skin contact, and from breastfeeding, because they'll get the bacteria from your skin in that way as well. So that's always something I like to tell people that they can look into a little bit more, and especially important if baby is born via C-section. As C-section babies are born into a sterile environment, they don't generally get the immediate skin-to-skin contact like they would in a natural birth. So those are another couple things to look into when breastfeeding. And then if you're coming to the end of breastfeeding or you have really low milk supplies, peppermint and sage decrease milk supplies. So if you're trying to build your milk supply, you would want to avoid those two herbs. But if maybe you're starting to wean and you want to decrease your milk supply a little more quickly, then you could begin to use peppermint and sage to help you do that. So those are a few things you can do to help support healthy lactation. And if you have any questions, as always, be sure to post them in the Facebook group.